Welcome, everyone, to your fire evacuation training for aged care facilities. Now, I know fire safety may not sound as thrilling as a trip to the theme park, but trust me, knowing this stuff could save lives. Plus, we packed this session with enough upbeat energy and practical tips to keep you riveted. So, let's light a spark of knowledge, but not the kitchen. Picture this. You're halfway through your shift, dreaming of your afternoon tea, and wham! The smoke alarm blares. Did you know a whopping 70% of fires in aged care facilities start in the kitchen? That's right. Never underestimate a runaway frying pan. But kitchens aren't the only culprits. Fire loves sneaky spots like overloaded power sockets, electric blankets, or even a poorly stubbed cigarette. And let's not forget those medical gadgets. The only thing scarier than a malfunctioning oxygen tank is someone trying to microwave their cuppa with a metal spoon. Remember, older adults are more at risk. Fragile bodies and slower reaction times mean staff need to be extra vigilant. Now to welcome our arsenal against the flames. Fire extinguishers with white bands are your go-to heroes. They handle most fires: wood, paper, oils, and electrical. Think of them as the Swiss Army knife of firefighting. They suffocate the fire by creating a barrier between oxygen and fuel. You'll find these white-banded beauties mounted all around your facility because they work on almost everything. Quick tip: remember the pass method? Pull the pin, it's not a grenade. Aim low, not at the ceiling, squeeze that handle, sweep side to side, pretend you're dancing. Fancy a fire blanket. They're not just for picnics. Use them in the kitchen to smother fiery pans. Easy enough, right? Fire alarms are the facility's hype men. They always want attention. Here's how they roll when a smoke detector triggers, depending on the type. It could sound locally for 2 minutes, giving staff a quick chance to investigate, or it may trigger the sirens directly. If it's legit or you hit a manual call point, boom! The full building alarm shouts like your favorite sports announcer. And don't even think about propping open those automatic fire doors. They're there to stop smoke and fire from going on a grand tour of the facility. It's time for the big acronym: RACE. The only race you want to win by staying calm. R is for remove anyone near the fire. Escort them out. If they're faster than you, let them lead. A is for alert. Shout fire till you're louder than the alarm. Smash that manual call point and dial 111. You know the drill. C is for confine. Close those doors, close those windows, unless you want to invite the fire for tea. Oxygen tanks, remove if you can. Do not open windows or doors just to check. E is for extinguish or evacuate. If it's small and you can handle it, fight the fire using the right extinguisher. If it grows up, time to move, not to play hero. Not everyone sprints out the door. Some residents need a personal evacuation buddy. PEEPs, Personal Emergency Evacuation Plans, are custom plans for your favorite residents who need extra help. Physical needs. Some want wheelchairs, others need a staff member per limb. Cognitive needs. Some might try to head back in for their teddy bears. Medical gear. Don't yank off oxygen tanks unless you want to play chase with chaos. Know your residents' peeps like you know your phone's passcode. Updated plans mean fewer surprises. Meet your local fire wardens. No capes or tights required. Just bright vests and steely nerves. Before trouble, keep exits clear, spot hazards, and teach the crew. During trouble, calmly point where to go. Check every room, leave a pillow outside so we know you've looked, and keep the chatter concise. Never re-enter for personal treasures. After, count everyone, help with reports. Make sure no one re-enters the building except professional firefighters. So, back to the battlefield. Kitchen fires love to sneak up when you're distracted by a good recipe. Never leave cooking unattended, unless you want to get cooked by a fire instead. Clean those hoods. Grease is like a fire's protein shake. Hot tip: if oil catches fire, don't toss water on it. Instead, turn off the heat. Cover it with a lid or blanket. Grab the fire extinguisher with a white band and start heading out if it doesn't calm down. And keep those commercial kitchen extinguishers within easy reach, not buried beneath last week's potatoes. If the fire's in a bedroom, help the resident out. Shut the door. Fire hates locked doors. Move them to a safe spot. Look everywhere. Beds, bathrooms, wardrobes. Pillow outside when all clear. Common areas, get everyone moving. Help groups, use wheelchairs, stay chill. Dementia doesn't like chaos. Bathrooms, announce, offer towels for dignity. Watch out for wet floors. Slips are not part of the drill. Therapy rooms. Turn off equipment, clear paths, guide everyone out. Not everyone's got the moves. Mobile residents just point the way and keep an eye out. Semi-mobile, arm or walking frame support, and a few words of encouragement. Wheelchair dependent. Clear the path, grab a backup if needed. Bedbound. These residents are likely to be instructed to be left in place. If appropriate, you may help them lie on the floor. Cognitively impaired. Calm, simple words, familiar faces, distraction tactics, and lots of patience. When it's go time, keep it short and specific. Never a gossip sesh. Intercoms. Calm instructions. No shouting panic. Unless you want panic. Call 111. Give the address, location, and the number of people needing help. Yes, we have real fire, not a burnt toast incident. Don't forget to fill in the families after things cool down. Their nerves are just as frazzled as yours. Practice makes perfect. We're not launching rockets here, but regular fire drills half-yearly do matter. Try out scenarios like blocked exits, night shifts, kitchen fires. Keep it unpredictable. Track participation, notes, feedback, improvement points. Practice should be your middle name. There you have it. Fire safety isn't rocket science, but it does need solid teamwork, quick thinking, and just a little bit of humor to keep us all sane. Know where your fire gear is, listen to your wardens, save the heroics for karaoke night, and most importantly, remember, speedy and safe evacuations keep everyone happy. Do the quiz, ace the test, and you'll be the MVP when fire strikes, without burning out. Thanks for tuning in and stay safe.